This is the Bryn Cooper Show, where we discover what's inside the deep, dark hole called your mouth. Are you ready?
Welcome to another episode of the Bryn Cooper Show. Today we're going to be talking about how to take care of your appliances. And I'm not talking about just braces or clear trays today. I'm talking about actual orthodontic appliances, such as an expander. See? Like this. And this is the most common appliance that I use in my practice. And it will actually make your upper jaw a little bit wider gradually over time to make space for teeth or get you at a crossbite or something like that. I'll have to cut that out. Other appliances that I use will actually move teeth front to back. Old school appliances were headgears. I rarely use them, but sometimes people want them because you just have to wear them at night. You don't have to wear them all day. Other appliances will kind of push one tooth, have springs. So there's all sorts of things. Appliances refer to a plethora of devices, and we can actually custom design them for each patient. And I definitely have. I know what I need to do, and I will actually design appliances from scratch, and it'll be unique to that patient, and no other person will have had that exact I'm losing the word. This is rare for me. Configuration. No one else will. So I know I have. There are custom appliances that I know where I want to move teeth, but there's no existing appliance that will fit that particular patient situation, and so they actually have a custom situation with their appliance, and you can order that from the lab. So it's really awesome when we know what we want to get done and we need to design it. We can design an appliance just for you. So when I'm talking about these appliances, the next thing that is a challenge is because most of the time they're in the roof of your mouth, or they might be a little bit bulky on the sides. So when you get the appliance, it's going to feel weird. It's definitely going to feel weird. There's no way around this. I actually had an expander that was larger than this one when I was 8, and I just knew it tasted so funny, and I knew I couldn't swallow the first 2 to 3 days. So go ahead and work on swallowing easy foods. Like, just start with liquids, water and soups and smoothies that first day. And then if you're a parent and you're worried about your child, they'll tell you when they're ready to try something else, because they'll be like, Mom, I want this, or Dad, I want this. If you're an adult, just move at your own pace. The best way to start speaking normally with an appliance in your mouth is to practice talking. There is a rainbow passage online, and it has every phonetic in the English language. And so if you read that aloud over and over and over and over, you will be able to speak with your appliance sooner than later. This also applies to people who end up getting the braces on the inside of the teeth. That rainbow passage will really help them too. So back to that first appointment. Be prepared for cheek retractors to be in. Go ahead and YouTube what to expect, or YouTube video, orthodontist bonding appliance. So you can always YouTube orthodontist bonding an appliance so that you can prepare for yourself for what's going to happen with the cheek retractors and the suction and everything like that. So that first appointment is going to be a little bit longer and feel a little bit annoying. Then you've got to get used to swallowing and speaking over the course of the next 2 to 3 days. But you should be pretty much up to normal within 3 days. If anything's poking or hurting, you put the wax on. You should get some orthodontic wax, and you can roll it up into a little ball and put it wherever it's poking or hurting you. And once you're used to talking and eating, then you are going to be just fine. If there's anything to do at home, like with our expander here, we do have a key that we put in, and you actually do have to turn it. We train you on that at your first appointment, and you can do that every day yourself. So if for some reason you're having issues doing something that's instructed, definitely call your orthodontist so that you can make sure you're doing it just right. But that's all there is to it. Appliances are really awesome and helpful, even though a lot of people aren't aware of them because they usually go inside the mouth and are a little bit hidden. But they can really help us get over a couple hurdles that might take several months in braces or clear aligners. So another thing with this, caries. The other appliance I want to discuss is the one most commonly used by me to correct bites, which is the carie. And so it actually gets bonded to the teeth, and you wear an elastic. You will hook up the elastic from the front of it to a button that we bond. And then you also have to have a clear tray. And that will correct your bite in the first 4 to 6 months. So you don't have to wait months and months and months to know if your bite is going to be corrected. The wonderful thing about this is that they're pretty discreet. They're on the side of your mouth, but you do have to hook up those elastics yourself. So sometimes that's part of the instructions with the appliance. The appliance is the carie, and then the instructions for you are to actually attach the elastic from the front of the carie to the button. When you're wearing these elastics properly with the carie, your bite correction should definitely take less than 6 months. So, very important, make sure you know what the appliance is for, and make sure you know what your part with the appliance is, and make sure not to break it and to keep it clean.
Thanks for tuning into this show. We want to know what questions you have, or even if there's a specific situation you want me to take a look at and share with the audience. That could be fun. Direct message us on any social media platform or email us at contact@cooperorthodontics.com. Ready for next time?